Today, we're diving into a drug that is, get this, part mouse, part human, and 100% revolutionary. It's called Infliximab, and it completely flipped the script on how we treat some of the toughest autoimmune diseases out there. So, let's start with a really important question. Imagine for a second, what if the very system that's supposed to protect you, your immune system, just went rogue and started attacking your own body? Well, that's not science fiction. It's the daily reality for millions of people with autoimmune diseases, where their own defenses are creating this constant damaging fire of inflammation. You can think of it like a fire alarm that's just stuck on, blaring 24/7. There's this rogue signal that's constantly screaming attack at the body's defenses, and that's what fuels this whole inflammation crisis. So, obviously, the first step is to figure out, what is that signal? Well, that rogue agent has a name: tumor necrosis factor alpha. We'll just call it TNF alpha. Now, normally, TNF alpha is one of the good guys. It's a protein that helps your immune system fight off infections. But in autoimmune diseases, the body starts producing way too much of it. It goes from being a helpful soldier to the main driver of all that pain and damage. And that is our target. Okay, so how do you take out a target like TNF alpha? You can't just use a sledgehammer. That would cause too much collateral damage. No, you need a new kind of drug. You need a highly trained special operative designed for one single, precise mission. And that's where Infliximab comes in. Now, this is not your average pill you pick up at the pharmacy. It's what we call a biologic medication. So what does that actually mean? It means it's a big, complex protein that's literally grown inside living cells. It's engineered to act like it's a natural part of our own immune system. And to get even more specific, Infliximab is a monoclonal antibody. The easiest way to think of this is like a smart bomb. It's a whole army of identical antibody clones, and every single one is programmed to seek out and lock onto just one thing with laser-like precision. And in our case, that one thing is TNF alpha. Now, here's where it gets really interesting. Infliximab is chimeric. It's a hybrid. About a quarter of it comes from a mouse. That's the high-precision targeting system that knows how to find and grab onto TNF alpha. The other 3/4 is human, and that part acts like a stealth cloak, letting the drug move through the body without the immune system immediately seeing it as an invader. It's a pretty brilliant piece of bioengineering, right? You've probably heard of it by its brand name, Remicade. These days, there are also things called biosimilars, like Inflectra and Renflexis. They're basically highly similar versions of the original drug that work in the same way. All right, so we have our special operative, this chimeric monoclonal antibody, and it's built for one purpose. So let's see exactly how it gets the job done. How does it neutralize that TNF alpha threat? Infliximab has this really clever two-pronged attack. First, it floats around and just mops up all the free-floating TNF alpha in your blood and tissues, neutralizing it before it can cause trouble. But it also does something else. It can find those overactive immune cells that have TNF alpha stuck to their surface, and it binds to them, basically putting a big "destroy me" flag on them for the rest of the immune system to take care of. It stops the problem right at the source. So that's how it works. But what has this special operative actually accomplished out in the real world? Let's take a look at the autoimmune conditions where Infliximab has been a game changer. The list of its successes is pretty amazing. For someone with rheumatoid arthritis, this drug can mean the difference between being stuck in bed and actually living a normal life. For people fighting Crohn's disease or ulcerative colitis, it can bring about a remission that feels like a miracle. And for conditions like ankylosing spondylitis or psoriatic arthritis, it can literally stop the disease from causing permanent damage. We're not just talking about treatment here. For so many people, this is a return to life. But, and this is a really big but, a weapon this powerful doesn't come without risks. By its very design, Infliximab dials down a key part of your immune system. And taking that action, as precise as it is, can lead to some serious collateral damage. Yeah, this slide here really gets to the heart of it. It's a constant balancing act. On one side of the scale, you have this incredible power to shut down the disease. But on the other side, you have the risk that comes from weakening your body's own natural defenses. First, let's talk about infusion reactions. These are things that can happen while the IV is going in or shortly after. That's why patients are monitored so closely for stuff like fever, chills, hives, or even changes in blood pressure. The good news is these can often be managed with other medications given beforehand. Okay, this is the big one, the risk of infection. When you block TNF-alpha, you're weakening the body's ability to fight off certain germs, and the biggest worry is serious infections. This is exactly why screening for tuberculosis, or TB, is absolutely mandatory before anyone can start this drug. It can basically wake up a dormant TB infection that the immune system was quietly keeping under control. And beyond infections, there are other risks. They're rare, but they're serious, so doctors and patients have to be on the lookout. We're talking about a slightly higher risk of certain cancers, like lymphoma, potential for heart failure, liver problems, and even some neurological issues. This is why constant, vigilant monitoring is just not optional, it's essential. So, with a risk profile like that, you can bet there are some very strict rules of engagement for using Infliximab. Let's walk through how it's actually given and the protocols everyone has to follow. First off, you can't take this as a pill. Because it's a big protein, your stomach would just digest it. So, Infliximab is always given through an IV, dripped slowly into a vein over a few hours. And this always happens in a clinic or hospital where you can be carefully monitored. The dosing schedule is also very specific. It usually starts with what's called an induction phase, 3 doses pretty close together at weeks 0, 2, and 6. That's to get the inflammation under control fast. After that, you move to a maintenance phase, with infusions every 6 to 8 weeks to keep things in remission. And before a single drop of that first infusion even happens, there's a whole safety checklist to go through. We already talked about the mandatory TB test, but doctors also have to screen for hepatitis, check your liver and kidney function, look at your blood counts, and make sure you're up to date on your vaccinations, because you can't get certain types of live vaccines while on this treatment. This quote really just says it all, doesn't it? Its power is matched by a significant risk profile. That is the core truth of Infliximab. It's this incredible tool that can stop a disease in its tracks, but that benefit is always in a delicate dance with serious risks that have to be managed every single step of the way. So, what's the takeaway here? Infliximab is an amazing weapon in the fight against autoimmune disease. It's that special operative that can go in and neutralize the rogue signal. But with that great power comes great responsibility. The very thing that makes it so effective is also what creates the risk. And that leaves us with a pretty big question for the future. As our medicines get even more powerful, even more precise, how will we continue to navigate that critical balance between power and risk? Something to think about.